Good day. Now I'm almost like an old friend. I've done this a good half a dozen times. Jerry Block's my name, a physician, an old doc, 50 years practicing medicine, and I'm still practicing. One of these days, I'm going to get it right. Well, Dr. David, you wanted me to talk about headaches, in particular migraines. Fairly common. Perhaps 15% of the world population has had, will have, or does have migraine headaches. Frequently, it's misdiagnosed. Misdiagnosis, sinus headaches, tension headaches, but they are migraine. There's a typical migraine, and then there's a common migraine. The typical migraine is what I learned in medical school. Unilateral, the word migraine comes from the Greek hemicranus, one side, pulsating in nature, frequently initiated by an aura, usually a visual aura, scintillating light, scotoma, which means holes, or jagged lines, which we call fortification. For years, I didn't know what fortification was. It looks like the top of the fort, zigzag lines when they put poles and make them sharp. And then shortly thereafter, there's this god-awful headache. The more severe the headache, the more nauseated, and frequently folks vomit. So it's called a sick headache. They have photophobia, that is, light bothers them. They want a dark room. They sometimes has presbycusia, that is, soft noise are very, very loud. So they want to go in a dark, quiet room. And there they stay 4, 5, 6 hours until the headache wears off. There's many causes of them, and we call this triggers. But there is a migraine diathesis, that is, a tendency that runs in families. Frequently, it starts even in childhood, and most times it occurs more in women than in females. And when it does occur in women, it's usually premenstrual, because that's when both the estrogen and progesterone drop, and there is a migraine. And this is sometimes referred to as a catamenial migraine. But there are other triggers. We all know that things such as nitrites in foods, the so-called hot dog headache, or with delicatessen, again, the nitrites that they use preservative. MSG, monosodium glutamate. Now, one doesn't have to go to a Chinese restaurant to get MSG. It's everywhere. In most prepared foods, for a tasting improvement, they put MSG. Some things, such as chocolate, it doesn't happen the day the individual eats chocolate, but 3 or 4 days later, it's a phentolamine breakdown product of chocolate that causes it. We all know that alcohol does it. Some things we really have a hard time, onions, chicken liver, avocados, bananas, some people, nuts like peanuts, citrus fruits, vinegar, herring can do it. Sometimes it's beyond our control. A change of 9 degrees in ambient temperature or a change in barometric pressure can precipitate a migraine. In addition to this, we talk about caffeine causing migraine. Really, it's not caffeine, but the sudden lack of caffeine. So many people drink coffee during the day, even some before they go to bed. I do. And in the middle of the night, their body runs out of caffeine and they wake up in the morning with a headache. We talk about stress causing a migraine, but really it's a sudden lack of stress. I had a patient not too long ago in my office, a minister, and his migraines typically were on a Monday. Well, sleep problems can do this, like sleeping too late one day. High altitude can do this. Strenuous exercise can do this. Fasting certainly can do this. And sometimes it just occurs. Well, these are the things that if we can find a trigger, it would be great. If we can't find a trigger, I recommend an aspirin, 5 grains of aspirin to prevent it. Why does aspirin work? Certainly it's not strong enough to relieve the headache. But migraineurs, this is what a person's called that has too much headaches from migraines. They have more serotonin in their platelets. The platelets are the formed elements in the blood that cause the blood to clot. Well, migraineurs have more serotonin, and the serotonin causes a change in the caliber of the vessel. So to keep the platelets intact, so they don't release their serotonin, I recommend 5 grains of aspirin, an adult aspirin every day. And by taking this, the migraine stays away. An aspirin a day will keep the migraine away, one of my patients told me. There are things that also will tend to prevent a migraine that are natural. Magnesium. My friend Magnesium that we talked about the other day with sleep, but also herbs, butterbur, feverfew, and a wonderful, wonderful vitamin. This vitamin is riboflavin, but 200 to 400 milligrams on a daily basis. Very, very safe and very, very effective. Now, these are preventers of migraine. There's also a list of aborters. That is, once a migraine starts, how can we take care of it? Unfortunately, most of this is drugs. The most common group of drugs that is used today is sumatriptans. The triptans, the first one was Imitrex, sumatriptan itself, and now there's a dozen others that are on the market. Frovia, Maxol, for example. Some are under the tongue. So I recommend 50 to 100 milligrams of sumatriptan as soon as the migraine starts. The earlier, the better. Now, sumatriptan itself is not a pain medicine, won't work on other kind of headaches, and some doctors use this as a diagnostic test. If the headache does not get better with Imitrex, sometimes they say it's another cause. There's a lot more to that, but in general, that's correct. Many times, the sumatriptan is not absorbed. So along with this, I use a drug to help it be absorbed. Because with migraine, as we talked about, there's sometimes nausea, the peristalsis stops, and there's no absorption of the medication. That's why I sometimes use under the tongue. So I use Reglan, an old-fashioned drug, a half or whole of a 10 milligram size along with the sumatriptan. I also use naproxen. Naproxen, 500 milligrams along with the Reglan, along with the Imitrex at the same time. And almost everybody will get rid of their migraine headache. A lot of other things that doctors use, such as ergotamines. They're available as a nasal spray, as an oral spray, and also as an injection. So this is my little bit on migraines. And in this day and age, no one needs to suffer with a migraine.